Are you thinking about becoming a nurse, but not sure what nursing actually looks like? Well, you're in luck because I asked real nurses for the truth about their nursing careers. Hi, it's nice to see you again.
Thanks, you too.
So, would you like to tell everybody your name and your title?
My name is Advah Shani, and I am a midwife working in Philadelphia area.
Very cool, very cool. So let's jump right into the interview. So what drew you to become a nurse midwife rather than pursuing other nursing specialties?
Um, I think since I was a child, I always knew I wanted to be some kind of a healthcare worker. I always said when people asked me what you're going to be when you grow up, I said I'm going to be a doctor. But then when I actually grew up and wanted to and started applying to colleges, I didn't really love the idea of medical school and working in a hospital with sick people. And all of a sudden, kind of, I understood more the reality of the being a doctor, and it did not sound appealing to me. So I just went I did a biology major just for my kind of undergrad. And with the idea of like maybe later on I would, get back to maybe something in healthcare. And then after I had my first child, when I gave birth to Lior, my oldest, I had a midwife for my birth. And it was, I think, life-changing for me in a sense where I kind of was at an age where I needed to shift directions. And I also loved the care that I got, and I realized that you don't need to work with sick people only as like a healthcare provider, but also um, just working with women and empowering women just really drew me in, and I loved that idea of just taking care of women.
Wow, that's really powerful.
Mhm.
Yeah.
So I went
Um,
back, to nursing
mhm.
school and kind of older. I was in my 30s when I kind of went back into nursing school.
Yeah, yeah. I'm kind of at the same crossroad. I was like, I want to do healthcare. I wanted to be a doctor, and now I'm like, no, I think
Mhm.
I want to be a nurse.
Yeah,
Yeah,
yeah.
yeah. Speaking about nursing school, what surprised you most during the like transition period from nursing student to like actually practicing nursing?
Because I went into nursing school with the idea of I already knew I wanted to be a midwife. I didn't really pause too much about the nursing school because to be a midwife, and I don't know if you know that, so a midwifery is a second degree. It's a graduate program. So you kind of have to go through the BSN, the undergrad of kind of nursing, and then do a master's in midwifery. And because I kind of knew I wanted to become a midwife, I didn't really kind of, the nursing school for me was basically just getting through nursing school so I can start midwifery school.
Mm-hmm.
So I did the 18-month program at NYU for nursing, and then I did not take most people, definitely most of the students that I was with, after they finished the nursing program, they were looking for nursing jobs and became nurses. But for me, I just continued straight into the master's program.
Mm-hmm.
So I didn't actually, I've never worked as a nurse. I just did the nursing school, and then I
Mm-hmm.
did the master's program to become a midwife. So your question is more for me, I feel like
Mm-hmm.
what would, kind of becoming a midwife. And of course, a midwife, I'm still kind of a nurse, as my kind of original profession or education, but it's definitely a little different than just being an L&D nurse,
Mm-hmm.
because mainly the difference between being an L&D nurse and a midwife is that the midwife, you're kind of managing the patient, you're managing the treatment, you're managing the course of labor. You're basically making the decisions. The L&D nurse is executing those decisions, and of course, it's a team work. We do a lot of thinking about how to manage together, but at the end of the day, as a midwife, you're the one who are kind of making the decisions of managing. And the other thing that kind of as a midwife, it's more of a whole spectrum of we do full scope care, which means that I see the patients in the office for their prenatal visits, since when they find out that they're pregnant, throughout their pregnancy, and then see them at the hospital when they go into labor. So it's definitely a more full scope practice of kind of seeing the woman throughout her pregnancy, and also a lot of GYN care. I do in the office, because I do work in an office too. I see teenagers, I see women of all ages, and basically take care of them throughout their life cycle for contraception, for infertility, for preconception, for menopause, like all of the women's health issues I manage, which is very cool. I love that perspective. So for me, what was the biggest kind of change of just finishing school and starting to actually take care of people? I guess the hardest kind of hurdle and kind of that step is that first year in practice. You doubt yourself a lot, and you don't have the confidence. And of course, even now I'm 11 years in to my practice, there's always doubt in your mind. But definitely the first year or two, it's a lot of like, I hope I'm doing, things right. And it takes time to build like confidence and build trust with patients. Um, but I loved that part of just kind of slowly getting to know the patients and building trust, and especially as a midwife. What I love, which is a little different, I think, than a lot of other nursing professions, is that you get to see the woman for very often, like, every 4 weeks, every 2 weeks, every week, like throughout the pregnancy. So you really build like a relationship with the patient. And then, of course, during labor for many hours, and postpartum after the baby's born. So you're just going to build a lot of trust and a relationship, which I feel like with other nursing, um, sometimes you just see somebody once a year or maybe once for their, specific medical issue, and then don't see them again for another year or two.
Yeah. Do you think that building a relationship with them and building trust provides better care for the patient?
100%. I think that's the basis of good care in medical, in everything, but definitely in medicine. When you don't have the trust with a patient, you can't give good care, because then the patient is always at that kind of very very vulnerable place of like, do I trust you to make the correct recommendation, the correct decision making for me? And in labor specifically, it's so hard because it's such a vulnerable place where the person is in pain or just going through a lot. And also you have to talk about like steps, about things that are going wrong, about decision making, that sometimes is so hard. So if you don't have that trust that's built through many visits, and it's just so hard to present somebody with a difficult decision sometimes, of changing their plan, when there's no trust, So that's
Yeah.
definitely really important.
Yeah. So I'm very interested in what your like typical day to day would look like, either in office, hospital.
So currently, I work at Bryn Mawr Hospital as a midwife, and I work in a practice, private practice. So I basically have 3 days a week that I work 4 days a week. So I have 3 days a week that I am on the labor floor, basically covering the labor floor for our practice. So anyone that comes to our practice, if she goes into labor, she will come to the hospital and I will manage her labor. And during that time, I also see the patients that already gave birth the day before or 2 days before and are still in the hospital. So I round on our postpartum patients. Um, I don't do circumcisions, but some providers do circumcisions for the babies. And then 1 day a week, I see patients in the office, and that can be a range of, GYN, which is gynecology, doing, as I mentioned, like birth control, STD testing, menopause care, just regular annual visits. Um, and or prenatal visits, seeing them through their pregnancy. So it's nice because my week and obviously the days that I'm on the labor floor, they're so fluid and so different every day because it's kind of let's see what the day brings and
Mm-hmm.
who goes into labor or who thinks her water broke or is maybe in preterm labor. There are so many different and aspects that we have a pager and you get these phone calls or questions and things from patients and you kind of need to deal with and respond. Um, and then the day that I'm in the office can also be such a huge variation with like who am I seeing? Is that like a 16-year-old that wants to talk about birth control options or heavy periods to a 60-year-old that wants to talk about menopause care. There's many different like options
Yeah, yeah.
or pregnant people.
Yeah. So you see a wide range of women going through different stages of life and
Yeah.
different
Yeah.
life experiences.
And of course, the patients postpartum that come in with their babies, and we do a lot of like breastfeeding support and how they're feeling postpartum and how they're healing or how they are coping, mentally with after having a baby. It's a lot of like things that are going on
Yeah.
through a person's life at
Yeah,
that point.
that's like very incredible, and it's great that we have a support system like that.
Mm-hmm. But before, for example, last year, this is a new job that I just took, but a year ago I worked at a birth center, which is an out of hospital kind of birth place.
Mhm.
Um, and I've worked there for 10 years, and that was a very different way of taking care of somebody as well. So there's definitely a lot of different options for midwives to kind of take care of people.
Mhm. And obviously, with pregnancy and birth, there's an emotional side of that. How do you balance that with the medical side of it?
I always say to my patients, and a lot of times, when they say, like, how can I get ready for the birth, or what do I need to do to kind of get ready? And I say, like, birth, I feel like is maybe like 60% like emotional, endurance and 40% like physical endurance. Maybe sometimes it's the other way, 60-40. But it's a lot of, especially at the birth center or people that are very kind of it's important for them to do an unmedicated to go through a birth unmedicated. You kind of need to prepare for it mentally So as the midwife at the birth, when you're helping somebody go through something so so hard, so emotional, so strenuous, you kind of are sucked into it, and I say I mean, I've definitely had so many shifts that I was with, only one patient, which doesn't sound a lot in medical, like, but I was with her, for like 6 hours of labor and, 3 hours of pushing. And we were kind of doing all positions and like, which was just so, physically, but even emotionally hard and kind of, just being there for her and it's like, you got this, you can do this. I know this is so hard, but let's keep going. And so it takes such, so much emotionally. And by at the end of the shift, you kind of feel exhausted, but
Mm-hmm.
also happy. It kind of depends on the day. Of course, there are also like everything in healthcare in life, there are also very sad situation where you're taking care of a woman that lost her baby or had a miscarriage of a very wanted pregnancy, or an outcome of the birth that wasn't a good outcome, and it's very heartbreaking and it's very hard to just be there for the family. Um, and it definitely takes such an emotional toll. But
Mm-hmm.
it's also kind of, I think, the amazing part of being a nurse or a midwife, or because you take care of humans and you're kind of with them, with their
Mm-hmm.
joys, with their sorrows. So it's so rewarding at the end of the day. I feel like it's not just a job of like going to the office and doing paperwork.
Mm-hmm. Yeah, you spoke about rewarding. Do you have a specific part during the birth or supporting the families that feels the most rewarding?
I mean, even after 11 years of doing this, every time after every birth or at every birth, it's just so amazing. I always get emotional when the baby is finally out and just looking at the faces of, the parent, the mom and dad, or, any parent. And it's just so, amazing to see
Mm-hmm.
their faces, their wonder, their joy, their like excitement. So that's always rewarding. I feel like the most rewarding things for me is when I am with somebody, a woman, that just overcomes such a huge hardship, or I've had so many times where they had a really traumatic first birth, or and they are pregnant again, and coming to birth, they just have so much fear and so much anxiety, and when they do overcome that fear, and when they have the birth that they wanted, or even not the birth that they wanted, because sometimes it doesn't go as planned, but they're kind of on the other side of it, and
Mm-hmm.
just seeing their joy and relief, and when they're so proud of themselves, that's also amazing to like, I did it, like I
Mm-hmm.
couldn't believe it, but I did it. It's really powerful.
Yeah, yeah. Um, can you share a moment that fundamentally changed the way you practice or viewed your work?
um
I know,
I
big
don't
question.
know. Yeah, exactly. I'm like, I don't know if I have like one specific.
Mm-hmm.
Um, I think it's more just accumulation of like being a midwife for so many years and learning over time, that I think over time, I think the most important kind of change for me was, and that's being young and out of school, and you're very ideological, and you're like, this is how birth should be, or this is how I want to take care of people. Um, and over time, you just see that, you know, it's not about your decision, your kind of what you think is the right way, or what you think is, um, good for the patient. It's what the patient needs from you. It's basically kind of meeting the patients where they are. Um, and for a lot of, and now I'm so much more like, you want an epidural? Great. That if that's your plan, I'm gonna work really hard to make this, because sometimes, let's say she had a really fast last labor and she just didn't get to get an epidural. It happened too fast and she kind of felt out of control. And this time she's like, I want to get to the hospital early and get an epidural and be comfortable. And it's like, great, if this is your plan. And that's, where before, like as a, baby midwife, I was like, well, but let's try and do it, without an epidural, or you went through it and you did great. So why not try again? And, for now, I think now the most important thing is I learned to listen much more to the patient and where they're coming from and what
Mm-hmm.
they want, and just try to help them, achieve their goal, rather than, of course, like it's into consideration what's medically realistic, or what medically is good, or safe for her and the baby. But I definitely um, kind of are less like, this is what needs to happen.
Mm-hmm.
um, which but yeah, but there wasn't like one event. It's just more over time. I see like not everyone has the same goals, the same needs, the same kind of priorities. So
Mm-hmm.
it's really important to just listen to what they need from you and how to help them.
Yeah. What experiences or types of mindsets do you recommend for students wanting to do midwifery?
Experiences, I think just seeing um, more places, more ways of being a midwife. Before I actually went into nursing school, we lived in Uganda for a year, and I volunteered at kind of a women's health center and a birth center in Uganda. And it was such a stark difference from, we were 2 hours away from any hospital. There was no such limited resources. We didn't even have running water. We, sterilized all the tools and open fire, and then going from that to like this, high-end hospital with everything at your fingertip. And
Mm-hmm.
again, like both of those the places are needed and are really giving women care, but they're just so different. And they just gave me such a good perspective of like what we have here, what other women, how other women kind of give birth in other places of the world. I worked with a midwife from England that they do things very differently there. So I think just being open, and if you have the ability to go to different places and see how other midwives work in different places of the world, is super helpful.
Yeah. You spoke of Uganda. Could you tell me a little bit more about what that experience was like?
Yeah, I volunteered at a birth center that two American midwives kind of initiated or started the project, the organization. But mainly it was to give support to local midwives. And I don't remember what year midwives were kind of not outlawed, but they were kind of frowned upon in Uganda, in the sense that the government was trying to bring more women into hospitals and not deliver or give birth at, in their homes, outside of the hospital. So until then, and even now, I mean, there were what we call traditional birth assistants. They didn't
Mm-hmm.
go through through nursing or midwifery. They were basically girls in the village that were chosen, usually the granddaughter or the daughter of a midwife, and just kind of learned the practices from the mother, the grandmother, and kind of was chosen to be the midwife of the village.
Mhm.
So they didn't have any formal um, education, but just knew a lot about birth just from seeing birth from when they were like 5 or 6. But they didn't have a lot of emergency skills or no resources at all. So this organization or the birth center that I worked with was basically trying to give support to those TBAs, traditional birth assistants, and giving them a little more knowledge about how to manage emergencies, medical emergencies, hemorrhages, newborn resuscitation, how to even date a pregnancy, which, is very, taken for granted here. But there, women don't have like calendars, and, they
Mhm.
don't know how many weeks or where they are in the pregnancy. And, um, they don't, many times they don't, even the midwives don't have any writing or reading skills. So it was we worked a lot with TBAs, but it was amazing to see these women who are just so knowledgeable in their culture, in their taking care of the women. Women, there would sometimes walk like 10 miles from their village to our birth center in labor to
Mhm.
just come and give birth. And these midwives would also walk because there's no other transportation or bike to the different villages. And those midwives knew every woman, every from all the villages around. They were healers, basically,
Mhm.
and they were very respected in their community.
Yeah, that's very inspirational.
Hmm. Yeah, it
Um,
was great to see that.
mhm. Yeah, you mentioned you earlier you've been practicing for about 11 years.
Hmm.
How have you seen midwifery like evolve throughout your career?
Um, and on one hand, I see there are a lot more midwives, and midwives are much more kind of integrated within kind of the medical world. Like now, every hospital that you'd go to, especially in the Philadelphia area, I don't
Mhm.
know much about other areas of the U.S., but I think every hospital that you would go into give birth in Philadelphia have midwives practice there as part of the kind of birth team, which is great. On the other hand, it's a little sad timing because the birth center that I worked with for 10 years announced that it's closing in November because it couldn't like afford to stay open, and financially it wasn't feasible. So uh, I think women in the Philadelphia area, at least, but all over the U.S., it's definitely a trend that the birth centers are closing, are having less and less choice of where to give birth, and it's basically either home birth, and again, there aren't a lot of home birth midwives because it's just getting harder and harder with all the different restrictions. Um, or the hospital, and there's just less where in England, for example, when I talked to when I worked with the midwives from England, and a lot of in Europe, and a lot of other countries, they just have a lot more choices.
Yeah. And for my final question that I have for you is what role do you see midwives in the future of like maternal healthcare?
There's so many research and so much evidence that shows that midwives help um, prevent or would just help with maternal health and improve maternal health in general. So I would love for, in general, to just have more and more midwives taking
Mhm.
care of women all over the U.S. Because there's so much evidence to show that it improves maternal health.
Yeah. Thank you so much for interviewing with me. It was great to talk with you. I learned so much, and I'm so excited to share this with other people.
Yeah, of course. Let me know if you have any other questions about
Yeah,
midwives.
I will. I will. Thank you so much.
Of course.
Have a
Good.
good rest of your day.
You too.
Thank you.